Neurofeedback training is like yoga for your EEG. And in real yoga class, you go and you get into certain postures and you hold them a little while. No one expects you to walk around in downward dog all day long for the rest of your life, but getting into that posture and holding it for a little while improves the flexibility and stability of your body. With neurofeedback training, more often than not, we're trying to get people to be more present. And that's usually in the sense of having a nice open focus, a calm external focus, or a more engaged focus, depending on what frequency you're rewarding. But those are the 3 EEG yoga postures we're practicing. We're practicing some type of presence. And getting into one of those forms of being present and holding that for a little while improves the flexibility and stability of your EEG, even when you're not hooked up to the computer. The feedback that I've gotten so far has been very positive about how it helps connect dots. A lot of neurofeedback providers, when they're first starting out, try to memorize every single detail, and you can't do it that way. You can't anticipate every situation you're going to run into. But if you have a context or a framework for understanding neurofeedback and you get a few main principles learned, then that context helps you remember the details because you have something to hang them on. So in the first couple of sections are just really laying the conceptual foundation or framework that's going to help you understand the method behind the madness, like why do we do what we do? And all that stuff clears up why you use certain reward frequencies at certain protocols. You have a way of understanding it based in the arousal model and based in certain neuroscientific things about the brain to understand why you're doing what you're doing. I would never go back to doing therapy without neurofeedback because it is such a valuable therapeutic tool, precisely because I'm getting a window into the person's current inner experience. And I'm going to see what gets in the way of them being present. The way we do one thing is how we do all things. So if somebody's doing neurofeedback training in your office, they're going to run into the same problems that plague them in their everyday life. You're going to have a mirror reflecting that back so you both can see what's happening and you have a chance to practice a new way of responding to things, and then you get feedback about how your new practice is going. So it's really useful, and you get information that you wouldn't necessarily get if you're just talking to somebody. And I mean, we will definitely be talking about that in the advanced beginner course, because a big part of what we're doing is figuring out what this mirror, this EEG mirror, is showing us about the client's current experience. And then what is it showing you when they start doing something different? And how can we reinforce the positive EEG changes and kind of get people unstuck from when they're stuck in a negative EEG recipe?